Hello everyone, I am Dr. Ranganatha, Senior Consultant and Lead Pulmonologist, Department of Pulmonology, Narayana Health City, Bangalore. Leading cause of COPD is smoking. If you look at the whole pool of the COPD, 75% of the COPD is because of smoking. However, other things like air pollution and indoor pollutions like cooking with biomass fuel, like the fuel made of animal dung, and also the firewood can also lead to COPD in the long run. And other causes like the previous infections like tuberculosis can heal leaving behind tuberculosis, and a person who started as asthma, which in the long run if it is untreated can also develop into COPD. Rarely people can also develop COPD because of the genetic causes. Smoking is the leading cause of COPD. However, in India or in many developing countries, because they extensively use the biomass fuel like firewood and the paddies made of animal dung to cooking and the daily use, exposure to that smoke also leads to COPD. In one study, it shows that like in India, in the rural India especially, the non-smoker COPD is much higher than the smoking COPD. So, person who is already a COPD will have the ups and downs of his symptoms throughout the year. So, the three important things which we use to assess the severity of the acute flare-up is increase in the secretions and change in the color of the secretion and breathlessness. If any one of that is there, we call it as mild flare-up. When there are two are there, we call it as moderate flare-up, and all three are there, we call it severe flare-up. Usually needs a hospitalization for further treatment. COPD and asthma have a almost similar symptom set. However, if you look at in detail, asthma is usually early onset disease. So, COPD is very unusual before 40 years of age. And if you look at the risk factors, COPD almost exclusively will have some kind of an exposure smoking or the air pollution. The asthma is related to more genetics and family history is strong in them. So, usually asthma also presents with many other allergic manifestations like allergic rhinitis, allergic conjunctivitis, allergic dermatitis, which help us to differentiate from COPD. So, what we need to understand here is once we have a COPD, we will have some kind of a baseline symptoms. However, if you avoid smoking, which usually a common factor which leads to COPD, and you be physically active and take your regular medications as prescribed by your doctor, and vaccination at periodic intervals would help to prevent the flare-ups and lead a normal life.